So next topic is diagnosis of pregnancy. So who is the first or who is the youngest mother? Do you have any idea? It is Lina Medina from Peru. Okay, she is around 5 years and 7 months when she was pregnant, when she delivered. Okay, so Lina is the youngest mother known. So the pregnancy diagnosis of pregnancy. How will you diagnose a pregnancy? It's simple. We can what we can define it into first trimester, second trimester, and third trimester. So the mainly diagnosis of. So Aisha, we are talking about diagnosis of the pregnancy. The pregnancy can be diagnosis of the pregnancy can be mainly divided to three areas. That is during the first trimester of pregnancy, second trimester of pregnancy, and third trimester of pregnancy. So what are the please contribute? What are the symptoms that you can see during the first trimester of pregnancy? What are the symptoms that indicate? What are the symptoms that indicate?
First, amenorrhea.
Nausea will be there. Okay.
Nausea, amenorrhea.
Amenorrhea will be the okay. Very good. Amenorrhea will be the
Yes. Morning sickness.
morning sickness. Okay, morning sickness will be there. Then
Vertigo.
vertigo will be there. Okay, fine.
And,
Fatigue will be there. Okay, fine. Fatigue will be there.
a UPT test.
No, we are talking about the symptoms, right?
Oh, okay, okay.
So see, pregnancy in trimester. See, UPT is the confirmatory method. So we are just talking about what are the signs, the symptoms that we can assess. So the person will be saying about amenorrhea norm, that morning sicknesses, fatigue will be the placental sign, that is cyclic bleeding. Cyclic bleeding will be there. It can be seen up to 12 weeks. Okay, please write down placental sign. That is cyclic bleeding will be there, which can be seen up to 12 weeks. Then micturition will be increased. Why increased micturition? Due to congestion of the bladder mucosa. Okay. Increased micturition due to congestion of bladder mucosa. And in the breast, you can see pricking sensation. Why pricking sensation? Because of increased flow towards the mammary glands. Okay. Next, so that are the symptoms. Next, we have to focus on the pelvic changes. Okay, the pelvic changes that are seen in first trimester of pregnancy. Pelvic changes. So first one was Jacquemus sign. I think you are very familiar about all these words. Jacquemus sign or Chadwick sign. Jacquemus sign or Chadwick sign. Jacquemus sign or Chadwick sign. What is this Jacquemus sign or Chadwick sign? It is dusky hue of the vagina. Okay, it is dusky hue of the vagina. Simply bluish discoloration of the vagina. That is dusky hue. Chadwick sign is known as a dusky hue of the vagina. Okay, why is it so? Why there is a dusky hue in the vagina? Because due to local vascular congestion. Okay, due to local vascular congestion, the hue it's seen as bluish coloration of the vagina. So that is Chadwick sign. Second sign is Osiander sign. Okay, second sign is Osiander sign. So what is Osiander sign?
Softness of cervix.
No, it is pulsation. Osiander sign is pulsation. Okay, it can also seen in pelvic inflammation. Okay, so this is the confirmatory sign, and alternative or differential symptom is pelvic inflammation. The Osiander sign can also be seen in pelvic inflammation also. So it is in Jacquemus sign or the Chadwick sign, or there is a differential diagnosis which is seen in pelvic tumor. Okay, in Chadwick sign it is known as the discoloration of the vagina, bluish discoloration of the vagina. So it may be due to pregnancy, or it may be due to, which is a differential diagnosis, or it may be due to pelvic tumor. Okay, in both conditions, vascular congestion will be there. Okay, clear. And the Osiander sign is a pulsation, vaginal pulsation, which is which is again seen in pelvic inflammations. And the third one is Goodle sign. What is Goodle sign?
Discoloration of the cervix.
No, cervix will be soft.
Okay, cervix. Sorry.
Okay, Goodle sign, cervix will be soft. I think Jyoti, I have asked you these questions and you had answered once. Do you remember this?
No, sir.
No, very good. Goodle sign, it is softness of the cervix. Okay.
Actually, sir, you asked to Selena.
Selena, okay, anyhow, okay, fine. Okay, so Goodle sign, see, when you touch your nose, that is the softness of the cervix before pregnancy. Okay, so during pregnancy, so you can when you touch the nose as well your lips, you can feel the differences. Okay, how hard your nose is and how soft your lips are. Okay, so in non-pregnant cervix condition, it will be hard as your nose when you touch your nose. So in pregnancy condition, your cervix will be soft as your lips. Okay, so that is a difference. There is a softness of the cervix. And what is the differential diagnosis? While taking contraceptive pills, also these things might happen. Okay, that is a differential diagnosis. Then what is Picac sign? What is Picac? No, it is that is a Picac Picac sign. That is asymmetric uterine enlargement. Okay, that is known as asymmetric uterine enlargement. When one half of the uterus is firm, whereas the other is soft. That is Picac sign, asymmetric uterine enlargement. Okay, fifth one is Hagar sign. Hagar sign. Aisha, are you following this? Aisha?
Yes, sir.
Okay, so a Hagar sign. So Hagar sign, it is a bimanual palpation. Okay, so by both your hands when you're like I don't know how to explain it without showing you the picture. So simply you please in Google please search how the Hagar sign is made. Okay, it's a bimanual palpation with both your hands. You will be cupping that Hagar sign. Sorry, you will be cupping the uterus so that in your hand, in your cupped hand, the baby will be present. Okay, but these tests are not done now because high risk. It's a high risk of a termination of pregnancy. Abortion rates are higher when doing the Hagar sign, so it is not done. Okay, sixth one is Palmer sign. Palmer sign. Palmer sign. So this is rhythmic and regular uterine contraction when during the bimanual examination. Rhythmic and rhythmic and regular uterine contractions when doing the bimanual examination. That is Palmer sign. So these are the things in the first trimester of pregnancy. So you have to focus on Chadwick sign, Osiander sign, Goodle sign, and Picac sign. So Hagar is not done now. And what are the changes how will you diagnose in the second trimester? So there will be quickening. You know what is quickening is, right?
Yes, sir.
Baby will be kicking. There is quickening at the 18th week. At 18th week, there will be quickening. And cloiasma, you can see it as in the 24th week. Cloiasma will be there. And linea nigra, if this is your abdomen, a line from the actually it can be seen from the xiphoid sternum to the umbilicus or umbilicus to the symphysis pubis. This is known as linea nigra. So it can be seen from the 12th week. And stria gravidarum, you can, like, these are the strias, right? Strias will be the. So this is linea nigra, then stria gravidarum will be the. Then the size of the uterus, which I have the size of the uterus, I just forgot to say that size of the uterus. So at the sixth week of pregnancy, it will be in the shape of hen's egg. Okay, it will be the shape of hen's egg. And at the 8th week, 8th week, it will be in the size of cricket ball. Okay. At 12th week, the size of the uterus will be like the fetal head. Okay. Fetal head. The size of the uterus, the shape and size of the uterus will be like the fetal head. Okay, then the size converts into what spherical and other things. Okay, that was about the size. Next is the level of uterus. That is important, yeah. The level of the uterus. So at the 16th week, the uterus will be around midway between symphysis pubis and the umbilicus. Okay. Suppose this is your abdomen, this is your umbilical area, this is your symphysis pubis. Okay, so that is the this is your structure. So at the 16th week, the uterus will be somewhere between the symphysis pubis and the umbilicus. It will be around here, midway between symphysis pubis and your umbilicus. Okay, this is at the 16th week, and the uterus will enlarge and it will reach at the level of umbilicus at 24th week. Okay, clear at the level of umbilicus. So it will cross the umbilicus, and just cross umbilicus at 28th week. And here is, suppose here is a xiphoid sternum. Okay, suppose this is your xiphoid sternum, and around 32nd week, it will reach the halfway between the umbilicus and the xiphoid sternum. Okay, and at the 36th week, it will touch the xiphoid sternum, and you can see lighting at the 36th week. Okay, so you can say, like, at the 35th week, it will reach the xiphoid sternum, and at the 36th week, okay, at the 35th week, it will reach the xiphoid sternum, and the 36th week, and at the 36th week, lightening will be there. So what is lightening? The uterus, the gravid uterus will fall
down on a
down and up, outward and downward. Okay, outward and downward. That is known as lightening. So at this time, the mother may feel some relaxation in the breathing. So otherwise, it will compress the diaphragm and it will affect the breathing. So at 36 weeks, the mother will be much comfortable in the breathing. And 40th week, what happens? Your baby comes out. Okay, and there is one thing that I must add, that is internal ballotment and external ballotment. Okay, so internal ballotment. Suppose this is the gravid uterus. Okay, external ballotment is through the external area. So you will keep your one hand here, and when you kick by the one hand, the size of the baby in this utero. Suppose this is the baby, and the baby will be pushed from here, and at this area, when you keep your hand at here, you can feel the baby at this area. That is known as external ballotment. Okay, so how the internal ballotment is done? So you will insert the hand through your vagina, and you will push the baby from here. Okay, so and the baby will touch at this point and bounce back, and you can see, and you can feel the baby at this point. Okay, that is external ballotment and internal ballotment. Okay, so and there are something other known as uterine shuffles, that is so soft blowing sounds and systolic murmurs at the left side, which is also in the uterine fibroid, and fetal shuffles, which is not important in our condition. Okay. So, and one more thing, what is Nagel formula? What is Nagel's formula?
Calculation of the
calculation, that is LMP plus
7 days.
9 months plus
Months
7
plus
plus
7 days.
7 days.
7 days. Okay, this is Nagel's formula. What is pseudocysis? What is a pseudocysis? This is a condition that you may feel that you are pregnant. Okay, in reality, you are not pregnant, but you may feel that you are pregnant. So next is, how will you calculate the fetal weight? Estimation of fetal weight. How will you estimate the fetal weight? So there are around two to three formulas. First formula is Johnson formula. Okay, Johnson formula. This Johnson formula can only be calculated if the presentation is vertex. Okay, it can only be calculated if the presentation is vertex. The second one is Hadlock. Hadlock, Hadlock, Hadlock formula. And third one is Shepherd formula. Shepherd formula. Both these two are computer based evaluation. Okay, both these are computer based evaluation. So that was about diagnosis of pregnancy. Clear. So before moving to next, what do you think? Shall we do some questions?
Yes,
Yes,
sir.
sir.
Okay, then mark the question. We'll do 10 questions and let us see how much you are able to score in this. Okay. So here comes your first question. So this question is from psychiatry. B. Who is not answering? Meera, Jyoti, Aisha. Shiny, what is your answer? What is your option? Shiny, what is your option? Okay, the answer is B. Sliding board. Okay, B is the answer. A nurse requests assistance moving the client from stretcher to bed. There are two persons available. Which of the following best method to transfer? Sliding board. Just so yeah, with Shiny, with two persons, it's not possible to lift sheet transfer. Sheet transfer is not possible with two persons. Okay, head you have to hold at the head, at the bottom, and the minimum 4 persons, 3 to 4 persons are needed. Okay, what about this question? Okay, fine. B is the answer. Okay, fine. Just a minute. Let me take the question. Aisha, your answer. So the person, it's a mixed response. A patient with duodenal peptic ulcer would describe pain as Generalized duodenal peptic ulcer, colicky pain infested by food. D is the answer. Okay. See, generalized burning sensation. Who said that? See, Shiny, generalized burning sensation can be seen in any of gastric. It's any gastric ulcers, for example, it can be like reduced by giving a pantoprazole. Okay. Intermittent colicky pain, no. Burning sensation relieved by food, no. Colicky pain fine, ingested by food. Okay. Okay, this one. Guys, please respond. Munira, Shiny. Like Munira, why you suggest B? Why you suggest B? Munira, why you suggest B?
Because doctor prescribe that 190 by 100 greater blood pressure greater ആയാൽ ഈ മെഡിസിൻ കൊടുക്കാന്നല്ലേ sir?
A patient admitted to the hospital in hypertensive in order to receive IV set for blood pressure greater than the best response is the answer is A. Why? Because it is ordered to receive hydroxyl, but and it is the condition is what? It is hypertensive crisis, right?
Yes, sir.
So A is the option. Give the dose immediately at once and once. So that it is and once. Okay. A is the answer. This one. Okay, fine, good. D is the answer. What about this one? Jodi, why you have selected B as an option?
Sir, I corrected it.
Oh, you have corrected it. Okay. Okay, this one. See, guys, it's nothing. You can see there is a specific gravity change in the specific gravity of the uterus. Okay, it's simply dehydration. So we have only 10 minutes more. Okay. Please answer this. B, shiny. Why B? See, shiny, it's a method to diagnose and locate seizure, EEG. Okay. PET is positron emission test, which is not the answer. Okay. The primary goal of therapy for a client. Munira, what is this D and A? My dear, you don't get such questions of multiple answering. Munira, please specify. Is it D or A? Munira, is it D or
Yes,
A?
sir.
A.
Yes, sir.
Okay, the answer is D. The primary goal of therapy for a client with pulmonary edema and heart failure. So the condition is pulmonary edema and heart failure. And so the primary goal, what is the primary goal of the therapy for a pulmonary edema and heart failure? So enhance, see, comfort is not at all an option. Okay, here the patient is having heart failure. So what is the comfort? If you are giving a person a 5-star hotel, it is a comfort for the patient. So comfort cannot be justified in case of severe heart failures. Okay, improve respiratory status, peripheral edema, or increase cardiac output. So cardiac output, the primary goal of the class is to increase the cardiac output, right? It is heart failure. Okay, I'm suggesting that you have answered the B question to improve the respiratory status. How the respiratory status can be improved? Since the patient is having heart failure, so the main aim is to increase the output, right? Then only your respiratory status will improve. What about this one? This is a simple question. I think all of you must be able to understand answer this. See, the patient is paraplegic, so both his legs are not functioning. So how can you give injection to dorsogluteal or vastus lateralis or retrogluteal? Answer is A, deltoid. Yeah, we won't give injections to paraplegic limbs. Okay, here's the answer. What about this? Okay, it's evaluation. Okay, fine. So how many questions we have reached?
11.
Okay, okay. Give me the feedback then. Jyoti,
Only
how?
2 are wrong, sir, for me.
Only 2 wrong. Okay, fine answer. That is great. That is great. Jyoti, what about you?
Same, sir.
2. Very good.
Same, sir.
Shiny,
9
shiny,
answers.
shiny. How about you?
5 questions wrong.
5 questions
Wrong.
went wrong. Okay, fine. Munira.
8 question correct, sir.
Okay, fine. You guys, you are doing very great. Keep the pace. Okay, this question. Guys, all these questions were asked for the prometric exam. Okay, so you are doing great. You're doing well.
Thank you, sir.
Okay, fine. Answer this question. B. B. Why B?
Motor reflex.
So you think it's B. A nurse is assessing the reflex of a newborn. The nurse assesses which of the following reflexes by placing a finger in the finger in the newborn's mouth. Moro reflex, sucking reflex, rotating reflex, Barbinsky reflex. What is the answer?
Sucking.
Very good. It is sucking reflex. Okay. B is the answer, my dears. You got confused. I think this is question asked once. Anyhow, what is the answer? I think I have asked this question, right? Okay. When caring for a patient who is intermittent claudication, a cardiac nurse advise a patient to apply guarded compression stocking before getting out of bed. Elevate the legs when sitting. Refrain exercises. I think I have asked this question. The answer is D. Walk as tolerated. Compression stroking is given for deep vein thrombosis. Okay, compression stroking is given for deep vein thrombosis. Elevate the lung while sitting. Why? There is no circulatory problems, right? Is there any circulatory problem affecting? So no need to elevate the brain. Refrain from exercises. No, you have to do the exercises. That's walk as tolerated. What about this? Gastric, no, it is activated charcoal, my dears. No, it's poison, right? First thing you have to neutralize the poison. So first thing is you have to administer the active charcoal, then to gastric lavage. Okay. So last question, we don't have much time.